Hi, everyone. So, disclaimer, none of this is medical advice. This is all for educational purposes. And what we'll talk about is what is myofunctional therapy, you guys? So, we all know what physical therapy is, right? Physical therapists do the physical therapy. Well, if you have physical therapy for your neck, you might need that. They might do a little bit of the jaw, but myofunctional therapy, it's what it is it's exercises catered to the tongue, the face, the mouth, the jaw, teaching the tongue how to be working on its own so the jaw isn't having to pick up the slack, seeing a lot of that forward head posture. So with myofunctional therapy, we see what can your tongue do from the beginning and work through the progress there. So can you stick your tongue out? Can you go skinny? Can you go side to side? Can you click? Can you puff your cheeks up? Different things that we're looking at there. Can you taco your tongue? Can you do a bowl? What about saying la ta da na, la ta da na? Is your jaw moving a lot? Are you getting a lot of jaw pain, headaches, forward head posture? Your neck hurts? You're clenching at night? What's going on? And when did this dysfunction start? I look at a complete history, how you were born, what interventions you've had. Did you crawl before you walked? It tells a lot about your body. There aren't many specialists out there that are looking at this full functional approach of your body from how you were born, how you ate. Were you breastfed? Were you bottle fed? Were you colicky? Colicky? Tension? Oh, you scooted on your butt. Okay. Oh, and you're still having these hip issues on that side. These are different things that we're looking at with myofunctional therapy. How are you breathing? You've been mouth breathing for decades, only breathing up here. We really want you to be breathing on your full diaphragm in here, not just belly breathing, but into the back and this back mediastinum area as well. We're looking at all of this there. When you're stressed, how is your body? How's your breathing? What's going on? We are paying attention to this specialized to you. So that's what myofunctional therapy is. Here we're kind of going through the exercises, getting more of the educational advice on that there. Now, with my myofunctional therapy here at NBOM, what we also focus on is diaphragmatic breathing, your hips, your feet, the full body functional approach. So, we really love the collaboration of other providers who are trained and specialized in these services: occupational therapists, speech pathologists, physical therapists as well. Here, what myofunctional therapy is teaching proper tongue placement and function. So, what you want is your tongue to be resting up here on your palate. Now, if your tongue hasn't been resting on your palate through development and through the first 4 to 8 years of your life, because by the time you're 8 years old, 80% of that facial and skull development is already done. So why are orthodontists waiting until their 12-year-old molars are coming in to put braces on? Don't really know because the growth's already done, but we're not here to talk about that. So myofunctional therapy, you want your tongue to be resting up here, not touching the teeth at all. If the tongue is touching the teeth, over time, moving the teeth. So sometimes people have braces and then their teeth move. Orthodontist is like, hey, you didn't wear your retainer, but really it's because their tongue was thrusting in different areas. I'm an expertise in this area. I mean, I did have braces like 4 times from all the times my tongue and my body was kind of moving around my bite. So now we know kind of functionality together. All right, so if you can click your tongue, some people can't. So then we know, like, okay, where are we starting from? Yes, surprisingly, some people can't click their tongue properly. Some people can't do it at all. Some people do it like oddly. I see some odd things, okay? Which is fine because then we know where the starting point is. So, oral resting posture, where you want your tongue to be, is like you're going to click it, but you're not letting it go. Your tongue is resting in a light suction on your palate. You may have heard about mewing. Now, it's not necessarily mewing. You don't need like a hard suction, right? Just a light suction on your palate. It also opens up your airway here if your tongue is suctioned to the palate, which I'll show you too as well with a photo that really shows the airway well. What you want is your tongue in that light suction. And then, I don't know if you guys know this, but your teeth should only be touching when you're chewing your food. Otherwise, your teeth should just be about 2 millimeters apart, barely apart. So your teeth barely apart. And then you should notice that your jaw muscles relax there. And then you can't breathe through your mouth, you're only breathing through your nose, right? So that's where you want your tongue to be. Now we have our vagus nerve that runs and integrates through our palate. And with the tongue in that position, helps rest, get your body out of that fight and flight mode, get you into that rest and digest mode there too, able to get that full diaphragmatic breath. So we think like thumb sucking, the binky, what's that doing? Stimulating that vagus nerve on the palate. Not only that, but pushing the tongue down, not allowing the tongue to get that brill proper movement, the tongue to get up to the palate there. So that's a little bit about what myofunctional therapy is. Exercises catered specifically to you is personalized myofunctional therapy. So you can be doing the exercises, but you need to be knowing if you're doing them properly. You don't want to be continuing these compensations. So you're like, you don't want to be doing that. Your jaw is working way too much. Who's going to tell you that? If you're doing like, let's say face yoga from some online account you found, you're like, yeah, I'm doing this face yoga. And that's what they're having you do. Your jaw is still moving a lot. You need personalized therapy, someone to tell you, hey, bite on this bite block that we have, and then that'll keep your mouth open. And then your tongue is just working on its own. Let's try this right now. That's what we would do in our personalized sessions there. I hope you guys found this helpful and continue learning on this process.